Hi, and welcome back to another episode of PainFreeFinally.com. I'm your host, Greg Roulette, here with Houston's senior specialist, Dr. John Trowbridge. And in front of us in this episode is the good old hip.
The hip.
The hip.
The hip. Now, you know, it doesn't look like one because you can't figure out how it sits there. This is the leg bone, okay?
All right.
All right. And this is the wing bone that you feel on the side, okay?
Yep, right here.
And in the center is where things attach, okay? And then you have a backbone back here that fills in this space.
Okay.
All right, and that's called, well, we'll go through that in the back thing.
Yeah.
Here's the neat thing is if you take a look at the hip, all those yellow things are rubber bands holding everything in.
Okay.
Now, we think of the hip, we've been told, you know, it's a ball and socket joint, okay? But it doesn't actually wrap around and hold it in. It sort of is available, but you want to be able to move your hip.
Yeah, you got to rotate it.
Lots
Yeah.
of different ways. And so it can't be locked in, it's held in by these rubber bands until it's not. Okay, how does that happen? Well, we fall. We get into sports injuries and so on. We get overstressed by carrying things the wrong way, stepping wrong. Oh, missing that last step coming downstairs.
Ooh.
Stuff like that,
Yep.
okay? And so when we overstress those ligaments that are holding things together, we can also jam those sweet, soft tissues of the bones together, okay? And create injuries on the inside. So you can actually rust your hip on the inside out.
Sounds fun.
Oh yeah, it's not that much fun. Don't do that. Don't do that. And the problem is what do we do? Well, when you break your hip, which is here or there,
Okay.
we pin them back together. All right. Well, yeah, that doesn't work for the arthritis part. So what we do is an open reduction internal fix. Now we do a hip replacement. Okay. Now you don't get new bone. You get new plastic and new steel.
Yeah.
Okay. And of course, they have to cut through all of these support structures. And people sometimes have kind of a wobbly hip afterwards and stuff because it doesn't heal quite right.
Yeah.
The interesting thing is, what if you could do it without surgery?
I think I would like that.
I would like that too.
Yeah.
So we'll just stick you on pain medications for a few years.
Oh, that sounds just amazing.
It's
I
delightful.
can't wait. Yeah.
Oh, and risky.
Yeah.
And risky. And the problem is, you use your hip for everything. You get out of bed, you get in and out of the car, you get in and out of the bathtub, whatever. Sit down, get up. All these things put all that weight on your hip. And remember, we stand two-legged, but we walk one-legged. So all of your weight
Yep,
is
every
going down
time.
through here,
Yep.
okay? And so if you've got a problem here with your hip, the question is there something other than drugs and surgery? And the answer is yes, stem cells work incredibly well.
So let's talk about that. How do stem cells work? How is that different from surgery? And how can that actually repair our hip?
Very good.
Instead of replacing it.
Exactly. Okay, here's the neat thing. All these rubber bands are inflamed and sending out a signal, hey, we need help, hey, we need help, hey, get over here and help us out. But the rubber bands and the joint structures themselves don't repair as readily as other parts of your body. And so the continuing inflammation is the continuing pain.
Yeah.
And what we do is find where your pain pattern is most, inject the stem cells into that zone, and let them do their magic. And it is really quite magic because they literally go in and instruct your cells repair all these injured areas. And it happens almost quickly. I'll give you an example.
Okay.
All right, I have a fellow, 58 years old. Comes in, I'm treating his knee with our prolotherapy, our reconstructive therapy. He says, can we treat my hip? I said, well, probably, tell me about it. So he's saying how 18 years old, he's a high school quarterback, looking downfield, the play is dead, and he gets hit with a helmet right on the side here.
Ooh,
now you've got
been there, done
thigh
that.
pads.
No,
Yeah,
yeah.
exactly. It's not fun.
It is not
You
fun.
got thigh pads in the front, but not on the side.
Yeah.
Okay. And he said they carry him off the field, white lightning pain. That's it. 40 years, daily pain. Daily and, of course, nightly pain. You roll over in bed, whatever, it hurts. He says, what do you think? And I said, well, let me get an x-ray. And I take a look. The structure actually looks pretty good. Doesn't look as bad as I would think with that
Yeah.
kind of history. He says, I want to do the stem cells. Okay. So we get the stem cells, we inject them, and a week later, he's fine.
A week later.
A week later. Now, the story doesn't end there.
Okay.
Okay. When you buy a hay baler, for example, order the deluxe super version where they put a step everywhere.
Okay.
Because he's stepping backwards off his hay baler 5 months later, no step. And you can just guess which hip he falls on. Okay, so bam.
Yeah.
Comes in, he is hurting. He is hurting. He says, so should we get more cells? And I go, why don't we just wait a little bit? Talk to me next week.
And I'm sure he's like, Doc, I'm hurting.
I'm hurting.
Let's do it.
Exactly.
Wait a week.
Gone. So They hang around. They're ready for another instance, another painful pattern. And they went ahead and instructed everything to heal, and it's fine.
Yeah, now this is really unique. I do want to take a step back and get us a little off track for a second, but I think this is really important because I think most doctors out there would say, sure, let's hit you with another injection.
Sure.
Right?
Right. But, you know, this is physiology. This is how you go through the process of healing. If you respect that process, you say, wait a minute, maybe we should give it a little bit of time. That's called applying the tincture of time. Okay?
Yeah. Well, the body wants to heal itself.
Exactly.
As long as it has the resources.
Exactly. And I knew I had put resources in. See, the unique stem cell product that we use is very highly active. It's safe. It's ethically obtained from umbilical cord blood. So it's not like the usual stem cells that you hear about. I mean, the vast majority of cells are not like this.
Yeah.
But I know exactly what I inject because it's what I used for me. Okay?
Yeah.
And
you only want the best for yourself,
Exactly.
so I'm only going to give my patients the best.
You deserve more. You deserve the best that I use for myself, for my healing, my future.
Yeah.
And that's what we injected for him. So I said, just wait, let's see. And by golly, that was all he needed, was just a little tincture of time.
Wow.
And he's all better and still doing fine. The great news is we don't know how long that lasts. We know the stem cells inside you from the time you're born last for a lifetime. Now they get steadily more impaired, steadily less able to do their job.
That's the aging process,
They're having
right?
birthdays, they're getting toxic exposures and nutritional deficiencies, illness, medications, and other stresses. But when we put fresh stem cells in like that, they don't care. They're ready to go to town.
Wow.
And they did, and it's marvelous. And I love treating hips because they do so well.
That's amazing. So there's someone watching right now. That's why they're watching this episode.
Exactly.
Is because, you know, doc, my hip hurts. You know, maybe I'm on prescription drugs. Maybe my doc is recommending surgery or something. How do I know if this is the right procedure for me, if stem cells is the right way, or if surgery is the right way?
Well, first of all, at PainFreeFinally.com, we have a quiz that you can take for any of your joints. And very often when someone's hurting in a hip, they also have other joints involved.
Right.
And the real question comes, what's your priority? Which to treat first? And some people say, I want to do both. Well, if it's right for both, that's good. But first, let's figure out where you are.
Yeah.
And you can do that very simply with a quiz, get the information involved, and then we also invite you to send me information, you know, your x-ray reports, what other concerns you have, because the idea is very simple. You want the procedure that's best for you to provide the results you're after. And if it's stem cells, then why are you waiting? If it's not stem cells, why would you even think about it?
Exactly, and I love that when you talk about results, right? I don't really necessarily care how it happens. I just want to be pain-free finally in my life.
And what we do works.
Exactly.
You know?
Yeah, lots of proven case records. You've been doing this for a long time.
Right.
And you're out there to help people. I think that's the best thing, because you actually want to see your patients get that result. Everything that you need is at PainFreeFinally.com. A load of information to help you learn more about what you're going through and how stem cells can help you repair yourself naturally. And go ahead and take that quiz. Also available at PainFreeFinally.com. Give the doc information so he can make the right diagnosis, get you the right treatment to get you back on the track, and most importantly, pain-free finally. Thanks so much for watching, and we'll see you in the next one.